Hello and welcome to Q&A with CNA, our monthly program where we get to talk to the employees and guests from the local Child and Adolescent Behavior Center. So today we have Lisa Cioffi, and she's going to tell us about her job later, but let's get to know Lisa a little bit better now. So tell us about your background. Where did you grow up, go to high school, all that?
I grew up in the Akron area. I went to St. Vincent St. Mary High School.
Okay.
Then I went to the University of Akron for college. And then stayed at the University of Akron for my master's degree in counseling, which eventually landed me to child and adolescence.
Okay. All right. So tell us a little bit about how long have you been there?
I have been at child and adolescence for 2.5 years.
Okay. And your title is Multi-Systemic Therapy?
Yes, I'm the program manager for our multi-systemic therapy program.
So you're going to need to explain what that is to us.
Absolutely.
Okay.
So I have been doing multi-systemic therapy for about 10 years. I started as a therapist and then became supervisor and then became program manager. We were at a different location before we moved to CNA. Multi-systemic therapy is a therapy that targets at-risk youth that are experiencing oppositional behaviors. We are in intensive home-based therapy as well, so we are going into the homes and meeting with families. The youth is our target, but we approach it from a family systems approach.
Which makes sense. It's
so
not
we
an
are
individual problem.
Yeah, we're including caregivers in all sessions because we feel like for sustainability purposes, and not just we feel like it's a researched and evidence-based program. So we follow a strict model so that we know we are doing what's evidence-based to work for these youth. And one of those components is including caregivers in all sessions because that allows the caregiver to understand the youth better, and it gives them the tools to be using on the youth when we're not there.
Okay. So is this for all ages? Like what age group do you work with specifically?
So we work with youth from 12 to 17 and a half.
Okay.
And the reason for 17 and a half is, you know, when youth are becoming close to 18, they often are having goals of, you know, leaving the home, moving on to college or getting a job or going wherever. And at that point, sometimes the therapy may not be as effective because they're not necessarily wanting caregivers that involved in their life.
Mm-hmm.
We
That's
can
typical for teenagers,
yes,
right?
and we can evaluate that on a case-by-case basis. If the youth is committed to remaining at home for a while and the family is wanting the youth to remain at home, then we can still work with that family.
Okay. All right, so explain to us, like, you know, an example of a youth that would need this type of therapy. What would be some issues?
So a youth that had some court involvement, like their behaviors have gotten them charges, like maybe becoming very argumentative with parents, and maybe that argument escalates into a physical situation, and then maybe the youth was charged with a charge regarding that, or maybe they're often what we call leaving the home without permission. We don't necessarily consider it being a runaway because they're coming back home. Mm-hmm. They just went somewhere without their parents' permission. So that is something that's often happening and becoming problematic for the parents to be able to manage. Maybe they don't know where the youth is. Maybe they're hanging out with youth that are getting in trouble. Maybe they're using drugs or alcohol when they're leaving home without permission. And the parents aren't able to get them to come home or stay home. Mm-hmm. So that would be another situation. Obviously, again, substance use. Other factors that we take into consideration is sometimes these behaviors are spilling over into school. So maybe they're not attending school,
Or not doing their
skipping
work.
class,
Yeah.
not doing their homework, becoming verbally argumentative with teachers, maybe often struggling sometimes even with their peers, maybe getting in fights with peers. So those are typically our youth that are coming into our program, youth that are very oppositional.
Okay. So does any of this type of therapy involve getting these youth together in a group session, or is it specifically individual and families?
It's specifically family therapy. Really kind of our goal when it comes to youth is gearing them towards pro-socials and peers that maybe are not engaging in the same behaviors, where it could be more of a pro-positive peer where maybe the youth will then want to kind of emulate some of those positive behaviors. So we're a very strength-based therapy, so we're looking at the youth and the family's strengths and trying to utilize those to help with the struggles. And one of the main focuses that we look at is getting youth involved in some type of positive activity, whether it's a sport, whether it's employment, volunteering, any other school interests that they have. Maybe it's not sports, even sometimes computers or gaming or anything like that. Anything we can get them in that's going to be a positive activity for them.
Okay. All right. So typically this therapy takes, I'm sure there is no typical. So you know, it could be 6 months. It could be a couple years, right?
We're a short-term program.
Okay.
We're very solution-focused.
Okay.
So we're going to get in, try to get things in order, or give the family tools so that we can exit, and then the family has the tools to maintain. So we're 3 to 5 months.
Okay.
We do have an adaptation to our program, which focuses on youth that are struggling with problem sexual behavior. And that program tends to be a little bit longer, but just because of the sensitive nature, and that can be 5 to 7 months.
Okay. What's the best part of your job? What do you like about it?
Getting to see families change, and in seeing parents and youth feel like they're a family again.
Okay. Is there any piece of advice or anything that you could give to a family that might be, you know, considering this type of therapy, or?
Yes. Hang in there. You know, it's difficult at first, but we are a very supportive therapy. We have 24/7 on call. So one of our MST therapists are there to support families at any time. And as we work through these things, it gets better.
Okay, very good. Well, was there anything else you wanted to add today?
I don't think so.
All right. Well, it's always nice to meet all the people that work at CNA. You know, all the different aspects that you guys, the lives that you touch. It's always nice to meet the people behind the scenes. And
Thank you. Thank you for the opportunity for us to share our program with the community.
All right. Well, thank you for watching Q&A with CNA. I'm Kyle Schwartz.